Beginning with this year's elections, voting gets a whole lot easier.
Your mailbox is your ballot box.
Your ballot packet comes to you in the mail.
But only if you're a registered voter. If you need to register or update your address, do it today at elections.hawaii.gov.
Look for your free Hawaii Elections Guide in the newspaper or at these locations statewide.
The deadline to register for the general election is October 5th, so don't delay.
Hawaii votes by mail.
Well, good morning and happy Monday to all of you. It is August 31st. Great to see so many of you already joining us. I'm Ryan Kalei-Suji, of course, joined by Yunji Denise. This is Spotlight Hawaii, where we shine a light on some of the issues that are happening here in the state of Hawaii. And Yunji, it may be Monday, but it's already off to a busy Monday. A lot of news already coming through early this morning.
Absolutely. And we want to mahalo, of course, our sponsor, the Office of Elections. Remember that you can register to vote from now until October 5th to vote in the general election. This discussion, we've now moved to 3 days a week. So we're going to be here Monday, Wednesday, Friday. And Governor David Ige has graciously agreed to join us every Monday for the rest of this month because there are so many questions about the response to the pandemic. And as Ryan noted, a lot of news today. About an hour ago, the announcement that the heads of the State Department of Health and Public Safety are retiring. So we want to welcome the governor, full screen there. And good morning, Governor. Please, let's start with those retirement announcements, if you would.
Sure. I mean, as you are aware, both Nolan and Bruce are longtime public servants and have really served the community well. They did inform me that they intended to retire, and I accepted their resignations.
Governor, was this something that was sort of planned out over time? I mean, retirement, obviously, there is some planning and consideration that goes into something like that, but there also have been critics of some of these directors during this time. How much of that factored into this decision for a retirement?
I told both of them during the course of the pandemic that I appreciated their commitment to public service. They had taken the situation, and obviously the coronavirus pandemic is a new situation. We are asking virtually every state employee to change what they're doing and how they're doing it. And both of them led their agencies in a way that allowed us to respond to this unprecedented pandemic. Both of them just talked about the grind of being in charge during this pandemic. And so certainly I appreciate everything that they've done.
Are these retirements that you asked for? I mean, is retirement a nice word for a resignation, or was this spurred? In other words, is this spurred by you or is it spurred by them?
No, they did not. I did not ask them for their resignations. They informed me that they would be retiring.
So what is sort of the next steps now? I mean, this is a difficult time for any sort of change in leadership in some of these departments. Can you talk a little bit more about who will be overseeing the department in these roles, knowing that this is happening in September?
Yes, I was able to, for the Department of Health, we did announce that Elizabeth Char will be taking the lead and becoming the director of the Department of Health. Libby's been very much involved with this pandemic from the very beginning on behalf of the city and county of Honolulu. She's been in the Emergency Operations Center at Honolulu, and I've consulted with her off and on for different issues as the pandemic has proceeded. So I'm excited that she agreed to come on. We do it, as you know, she's an ER doctor, so she's definitely, been at the front lines of first response. She's a quiet leader, but will be very effective. And many in the department know her because the state and the county works together on so many issues. So I'm looking forward to her joining the team beginning September 16th. In the case of public safety, we are beginning the transition process, and I'll have a few announcements as we go along and proceed through the process.
Okay, shifting gears now, Catherine Cox has a question about another big story in today's paper, and that was what happened regarding the labeling testing error. Can you shed a little bit more light on that? We know that up to 1,000 tests were not labeled properly, and so may or may not be able to be processed. What's the latest on that?
My understanding is that they do have a record of whose tests were mislabeled, and they did reach out to the contact information, and will be informing them and giving them another opportunity for them to be tested. There's a lot of people that are taking different parts. Obviously, trying to conduct 60,000 tests in a 2-week period is a monumental task. And we're challenging many people, many public servants to really step up and do things that they haven't done before. So, I know we'll get better working with the county and state moving forward. It's unfortunate that those test labels were mislabeled, but we will have adequate time for those who wanted to get tested to be tested.
What are we looking at in terms of timeline of when we're going to start seeing those results? Because, we talked to the mayor on Friday, and he was saying, that first day they stood up close to 4,900 tests in that day. Obviously, those test numbers, and because of the volume, will likely increase the number of positive cases that we see. When could we start seeing those numbers reflected in those daily counts?
I did ask the department to account for those tests separately from the daily count, so that we'll report all numbers, but clearly identify the results of the surge testing separately from the normal daily testing that you'll see. So at least people can get a sense for what the normal activity was, and then what the surge testing would be. We do anticipate, Ryan, we're more than doubling the number of tests that we typically do on any given day. So we do expect that the number of cases would be doubled. But we are also know that we're making this test available to anybody. So you don't have to have symptoms. You don't have to believe that you've had a close contact. Anyone who wants to get tested can get tested as part of this surge testing program. So we would anticipate that more of the people in the surge testing would be negative just because they haven't been exposed, or they don't believe that they've been exposed. Everybody in the regular testing has either contacted the doctor, been informed that they're a close contact, or are symptomatic, or others. So we'll see what the numbers are. We do anticipate increased number of cases. We'll be able to hopefully present it in a way that you can tell who is part of the surge testing and who is not.
Daryl's got a question here that a lot of folks are thinking about. Need to address neighbor island issues just as well as the island of Hawaii, especially Hilo. There is this concern, especially on Hawaii Island, that we have seen more cases there, that the rate of cases, positives, has been going up. Yesterday, we saw the first 2 deaths in Hilo. So do you anticipate perhaps some of the neighbor island counties having to do another shutdown as well? And what are your thoughts about increasing testing on Hawaii Island and on Maui?
Yeah, we've actually been increasing testing on Hawaii Island already, working with Mayor Kim. They've been pretty aggressive in stepping up the testing. So some of the increase in the numbers are actually due to the increase in testing. They've been focused in Keau and some of the other communities where they've seen clusters. Mayor Kim is very focused on ensuring that we can get out and into those communities so that we can test those who may have been exposed to the virus. We will continue to increase the testing as appropriate. On Maui County as well, working with Mayor Victorino in response to the contact tracing, we will always, if we identify what the source is or what the event might have been, we do go into those communities with focused testing, trying to get to as many close contacts and others who may have been exposed. And there will be increased testing in both Maui and Hawaii Island. we continue to meet. I continue to meet with the mayors 3 times a week to talk about further actions. Up until this point, yes, the number of cases have increased in Maui County. Number of cases have increased on Hawaii County. We've increased testing in both of those areas in response, especially as part of the contact tracing activity, and we will continue to do so.
Do you think that it's a possibility that we would see a shutdown on either of those islands?
The actual case counts and the number of cases per 10,000 is which allows us to examine the case counts more carefully. Certainly we're concerned with the increase, but we didn't see the exponential growth in the cases that we saw here on Oahu. So we do believe that it's still very isolated. We've been able to identify those who are infected and gotten to their close contacts to limit the spread.
One of the questions, of course, that we're getting, and a lot of them are kind of surrounding this, DK, just simply asking you, so will the shutdown be extended overall? We do know that, of course, the island of Oahu is sort of in that state right now. Do you foresee it lasting longer than these 2 weeks, especially maybe now that we will potentially see these higher positive numbers because of the surge testing that's happening?
Ryan, we've always said that the biggest concern, and people ask what triggered the shutdown. It really is the healthcare capacity. We've all seen what happens when the hospitals get overrun with too many patients and not enough beds. We did see with this expansion in the cases over the last 3 or 4 weeks here on Oahu, the hospitals are filling up, and in very short order, in about 3 weeks, we went from less than 50 COVID patients in hospitals all across the state to more than 200 in very short order. And so, that's what drove the shutdown, the concern in the number of cases. The hospitals are stressed but not overwhelmed, and we want to make sure that they don't get overwhelmed. I think that that's the critical balance that we're trying to implement.
Okay, there's been a lot of criticism at the Department of Health, rather, and just today in the paper. Again, we keep referring to the paper because there's so much news in it this morning. The State Auditor saying that the Department of Health, basically, some of the officials there stonewalling his efforts to investigate the contact tracing program. Are you satisfied with the level of contact tracing that is happening right now? And what do you think about those allegations of being stonewalled at that level?
The auditor had made a request to interview officials at the Department of Health. They were actually in the process of standing up contact tracing. So we asked that they reschedule those requested appointments. We made Director Bruce Anderson available to meet with the auditor, and he did. We did not stonewall. We just asked that the interviews be scheduled at a time when the leaders were not busy in standing up more contact tracing. So, I'm certainly disappointed that he went ahead and published. He made the request, I think, a week ago. We responded, asked for rescheduled, and then next thing we knew, he published the audit. So, we continue to provide access to information. Just would want to remind people that we are in the middle of the pandemic, and many in the department are involved with responding, implementing training, and expanding the number of contact tracers.
Another question that we're getting a lot of comments on, and I can't look for one specifically at this moment because there's so much comments, but one of them is the new plus up, so to speak, money that was just passed over the weekend, $300 now being allocated by the federal government that will be applied to those who are filing for unemployment. What will that process look like? Is that a completely new process that people have to reapply for? Is it something that will be sort of extended from if they were getting the 600? Can you sort of walk us through what that will sort of look like?
We will definitely be providing more information to everybody involved. Ryan, as we've talked about before, the system that the UI is based on is very old, and we have to go through that whole program to reprogram the system to be able to do this $300 plus up. So we initiated it almost immediately after the president had announced it, but it still takes 4 to 5 weeks to do the program changes and verify the accuracy to be able to provide the additional money. We believe that we will be able to implement it for those already receiving benefits, but we'll be providing more details about what each individual would have to do to be able to receive the benefits.
I want to bring in Cassandra Yuen's question. It's more of a comment, but she says, Ryan, this is around 10:43, full shutdown instead of prolonging this so people can get back to work and kids can go back to school. Hammer, not the scalpel. You know, there are differing schools of thoughts as to how we should handle quelling the virus. So far, it does seem to be county by county, and even within that, really trying to target the shutdown as opposed to doing a full blanket shutdown. At what point would we reach a level where we go back to what we were looking at in March, where there is a full scale hammer, so to speak, that Cassandra is calling for?
You know, I think, Yunji, it's we need to live to learn with the virus. You know, we're going to have it. Even though there's a fast track on a vaccine, it still will not be available in the volumes that would be necessary to really ensure the health and safety of our community. So I think each one of us has to realize that everything that we do, we have to do differently. That really means wearing your mask even at home. You never know who might be exposed to the virus, and you know, unless everyone in your home is completely shut down and not going out and not interacting with anyone, you know, the only way for us to keep each other safe is for all of us to act as if we're infected. Wear your mask all the time. Maintain 6 feet of different distance. You know, as I said at the beginning, the reason we led to the shutdown was because of the concern of the healthcare system. You know, in what we would want everyone to do, you know, every business needs to change how they conduct business to maintain social distancing, to stop the spread of the virus. You know, virtually every industry, every organization needs to think about what they can do to help fight the spread of the virus. And, you know, the new shutdown order closes lunchrooms and other kinds of things because we noticed that more and more people were getting infected in what people would consider innocent kind of exchanges. You know, having lunch with coworkers. You know, you don't know who's infected, and if you're within 6 feet, that's just a prime opportunity to spread the virus that we have to shut down. We have to shut down physical interaction face-to-face of people in order to stop the spread of the virus.
You know, over the weekend, we saw some of demonstrations and some people in opposition of the shutdown and in opposition of the mask order that has been in place. You know, they had a caravan that went through downtown and into Waikiki, as well as a rally that was held at Honolulu Hale. What would you say to your response to those who are in fact gathering? Of course, they are protesting this. They do say that they plan to have more of these rallies, so to speak, against the lockdown. What is your message to those individuals who are seemingly saying that this lockdown should not be in place?
You know, we're just saying that in order for us to fight the spread of COVID-19 and be successful, we all need to be part of that success. Everybody needs to take personal responsibility, stop doing the things that spread the virus, and start doing the things that keep you and your neighbor and those who are close to you safe. And that means wear your mask even when you're at home, keeps physically distance from each other. You know, those are the kinds of things that will make a difference in the spread of the virus. And, you know, there is not going to be some magic thing that happens that the virus disappears. You know, we're going to have to live with it at least for the next 12 months. And the more that we recognize that virtually every aspect of our lives have to be re-implemented in a way that keeps our community safe, that's the only way we'll get the case counts down. That's the only way that we can begin to reopen our economy. That's the only way that we can get to the new normal that is required with this new coronavirus.
If that is the thinking, that we are living with this for the next 12 months, if I could ask you just briefly about schools, Raina Lynn Akau says, our children shouldn't be guinea pigs. If you keep adults home, keep children home too. We know that the statewide school system is distance learning until October 1st, or yes, until October, not the 1st, but through October. The first quarter, essentially. What are you thinking beyond that? Is this something that we're keeping kids out of school for the rest of the year, if indeed, we're living with this for the next 12 months or so?
We are, Yanji, there's a couple of things. We definitely are living with the virus, and, we've transitioned the students to distance learning for the most part. We do know that some children will have a hard time in distance learning. We know that some special needs children have services that are required to be delivered in person. And so we want all of our children to have the ability to learn. We do see more and more new tests that are coming online that are accurate, that are quick, that are inexpensive. I do believe that these tests can be game changers in safely restoring face-to-face learning, to safely return to the visitor industry. And so we are examining those new tests, trying to acquire them if we believe that they are efficient and effective. Because we do know that being able to test quickly and accurately is a game changer if the cost is manageable. And that's something that would allow us to get back to the new normal much, much quicker.
One of the other questions that are coming up and people are concerned about, of course, are just businesses in general. And with the lockdown, this is further damaging some of the overline budgets for some of these businesses who are saying they will no longer be able to operate with this second shutdown or any extension thereafter after this 2 weeks. What sort of specific services or grants or programs can the state provide? Is there any other relief coming in form of CARES money that can go to these small businesses and those who are struggling now because of this second shutdown?
We are working with the counties. As you know, Ryan, I did distribute pro rata funds to each of the counties, so they all have a share. We have talked about, those kinds of programs that we think the county is better positioned to be able to support that. And support to businesses, food distribution, support to other kinds of businesses and organizations that have been impacted by the coronavirus. We do believe that the counties are better positioned to be able to do that. The rental assisting program we are pursuing at the statewide level as well. I know the counties do have rental assistance programs. We are talking with them. Should they be able to distribute all the funds they have for business support programs, for rental assistance, for food distribution, should there be additional CARES funds that the state still has, we definitely would make available so that it could be distributed to those who need.
You mentioned also tourism when we were talking about schools and testing. Is October 1st still the goal for reopening transpacific travel, or is that moving later? Are we looking at November, December?
Yanji, we've been continuing to implement all the different parts of the pre-travel testing program that we announced earlier. Starting tomorrow, the Safe Travels Hawaii app will combine the inter-island quarantine with the trans-Pacific quarantine. So it creates a digital platform so that all of those on quarantine will be on the same database. We'll be sharing information between the state and the counties to help support law enforcement in that regards. The new app will also, on a daily basis during quarantine, be able to make contact with those in quarantine or isolation, ask them for health status, and really help us keep track of all of those who are in quarantine or isolation. So that's all part, this program will be part of the pre-travel testing program. We're working with the counties to work through the bugs, so that will help us to get ready for October 1st, should that be the date. But again, the main concern at this point is status of our healthcare system, our ability to keep our people healthy and make sure that we don't overwhelm the hospitals. And so we continue to monitor that activity each and every day.
Another question and topic that came up recently over the week is the filming and production of a reality TV show, of course, Temptation Island, on the island of Maui. Can you give us an update on that status and the decision that you made to allow this programming to take place and this filming, and what sort of is the status update, I guess, on that project?
We did meet with the digital and film production professionals, the unions, and had a good conversation about what standards should be in place. They are fully committed to apply and implement quarantines as required. And they have an extensive testing program that, depending on where you are in the production, those who can wear face coverings are wearing face coverings. Everybody in the production gets tested at least once a week. Many who may have higher exposures would be tested even more frequently than that. So, I do feel comfortable that the film and digital media industry production guys have embraced the responsibility of living with COVID-19. They do have explicit plans to test. The union members have reviewed the plans and fully support the activity. So we do feel comfortable with moving forward with the filming activities. They've also agreed to enforce and implement kind of a bubble around the production site, make sure that residents don't get exposed unnecessarily to anyone who may be infected. But like I said, they really have a very rigorous testing program in place to ensure that should someone become ill, that they'll be identified very quickly and that healthcare can be provided.
We know that you have your weekly meeting with the island mayors in just a few minutes, so we know we have to let you go, but we just want to give you a chance to give us some final thoughts. And again, we'd really appreciate you coming on for so long, and the fact that you've agreed to join us every Monday for this month. I think we'll have a lot to talk about, and judging by the comments, which we will go through, I'm sorry that we didn't get to all of your questions, but we tried to get to as many as possible. But just some final thoughts for folks who, a lot of people feeling really frustrated that we're back in this position. Some people feeling like the lockdowns are not enough. Some people feeling like it's too much. So what do you say to people on both sides this morning?
I do want everyone to know that we continue to take action based on the data that we see. We are definitely focused on the health and well-being of our community and the healthcare capacity, the healthcare system that we have, and making sure that it doesn't get overwhelmed. We've all seen the video of what happened in New York and New Jersey when, they had patients in the hallways of hospitals and really in a situation that doctors were choosing between life and death for those infected with COVID. I know that this is a stressful time. I wish that we didn't have to do the second lockdown, but we do believe that it's in our community's best interest to implement the second lockdown at this time. We all need to learn to live with COVID-19. It will be in this community for a long time until a vaccine is developed and able to be distributed. And so all of us need to take personal responsibility. Think about everything that we do and how do we do it in a safe way if I'm infected so that I don't spread the virus to someone else. So I appreciate all of the sacrifices that everyone in our community has made so far, and I know that the next 2 weeks and beyond that will continue to be very tough and challenging. I appreciate everyone's efforts and everyone's investment in our community because we have always learned that we come together as a community when we are challenged. And I'm asking everyone to do the same again. Come together to help take care of our community, take care of each other, and most importantly, help keep everyone safe and healthy. Aloha.
All right, Governor Ige, thank you very much. We look forward to seeing you right back here next week, Monday. Aloha.
Okay, well, Ryan, so much to talk about. And as we said, so many comments. We appreciate all that you had to say, even the negative ones. We read every single one. And we do know that there's a lot of frustration out there, and we feel it ourselves because nobody wants to be in this circumstance at all. The governor addressing right off the top the retirements of Bruce Anderson and Nola Ispinda from the Department of Health and from the Department of Public Safety. He made very clear that these are retirements by their own choice and not forced resignations, Ryan. But both of those officials getting a lot of criticism over the last few months.
Yeah, certainly. And he's saying that it wasn't something that he asked for, that this was sort of decision. And he also expanded on the new director that will be taking over the Department of Health. I'm sure we're going to get more information as this unfolds, but the timing really quickly here as the retirement is happening on September 15th, essentially that they're working to mid-September with a new director coming over. Of course, a lot of transition will have to be implemented into both of these departments, which have been under such scrutiny lately. So we'll see how this sort of unfolds and how it plans out. We also talked about some of the surge testing. Interesting to note that he has asked that the Department of Health separate the different testing numbers that come through. So we will see two different sets of numbers, those that we continue to see on this daily basis, as well as another set of numbers that are coming from these surge testings to really identify which is which, because he said we recognize that the numbers are going to be higher because of the volume that we're getting from these surge testing. Of course, another headline is that there will be an additional 1,000 people, so to speak, have been asked to retake the test after some mislabeling happened with the department as well.
Yeah, and you know, I really noticed a change in what he was saying in terms of living with the virus so long. You know, as long as we've been talking to him, it felt like the goal was really to eradicate the virus. But he said repeatedly that we have to learn to live with this in our community for the next 12 months and perhaps beyond, depending on how long a vaccine and distribution takes. And so what does that actually look like? They're still figuring that out. Not committing to October 1st as the transpacific travel opening up. That's, of course, a goal, and that would be the earliest, but it doesn't sound like that's definite at all. They're really just focused on hospital capacity.
That's right. And we know that we are seeing a lot of questions here about unemployment. Of course, that continues to be one of those issues here that the department has continued to try to fix over time. We still are getting reports of people waiting for 4 months, still have not gotten any of that support yet. And we're going to be talking directly with the department on Wednesday to get more information for those of you that have some of those unemployment questions.
Yeah, we're very excited to welcome, I want to make sure I get her name right, Anne Pereira Estaquio. She has been taking over for Scott Murakami. He, of course, was the director of the Department of Labor and Industrial Relations. He was on this program quite a bit when the pandemic first started, sort of walking us through all of the steps you needed. He retired, and so she has taken over. We're welcoming her on Wednesday. And then on Friday, Corey Rosenlee from the State Teachers Union will be joining us to talk about how school is going and whether he thinks October will mean that we can go have the kids go back to school in person, or if this is going to be continuing beyond that.
That's right. And again, we encourage you to continue to, and we are moving to a Monday, Wednesday, Friday show schedule. We're expanding our show by one more day. So again, we will be here every Monday, Wednesday, Friday at 10:30. We also have some very interesting conversations coming later in the month of September. We're going to be talking and doing sort of a conversation with some of the candidates in some of the big races that are happening for Honolulu Mayor, Big Island Mayor, as well as the prosecutor here on the island of Oahu. It's going to be a discussion where we're going to sort of engage you, the viewing audience, as well as, of course, the Star-Advertiser editorial board and those who are involved in that. So encourage you to keep an eye out for that information. But again, we want to thank everybody for tuning in. We know out there that there's a lot of frustration. Clearly, there's a lot of comments going out there, some directed towards us, obviously, some directed towards the governor. And really, our goal here is just to try to provide you folks information and get you sort of updated on things that are happening here with some of these leaders. And we hope that this information is useful to all of you as we sort of navigate through these uncertain times.
We thank you so much for joining us this morning. Remember to register to vote. October 5th is the deadline for the general election. Make sure your voice is heard, so you can head over to the Office of Elections website to make sure that your address is correct. Remember, Hawaii does vote by mail. It's an all mail-in ballot this year. And make sure that you can have your voice heard at the ballot box. Until Wednesday, we bid you a fond aloha. Please stay safe, wear your mask, socially distance, and we'll see you right back here at 10:30 on Wednesday morning.
Aloha.